Hysterectomy is one of the commonest surgery. In fact, it is the second most common surgery done on a woman. So whenever we talk about a hysterectomy, women start wondering, oh my gosh, is hysterectomy gonna put me in menopause? What's gonna happen to my sex life? Now, let's start with what is a hysterectomy. Hysterectomy means removal of uterus and cervix. Just removal of the uterus is not going to put you in a menopause. Menopause will happen if you don't have hormones. Now, the hormones are produced by your ovaries, and every time you have a hysterectomy does not mean we're going to take the ovaries. In fact, removal of the ovaries is not common at all. So if you're worried about hysterectomy and menopause, stop it. The second common question is, what about sex life? Well, what about sex life? As long as your hormones, your sex life should be the same. Nothing should change before, during, or after sex. There should be no changes at all. In fact, some women say that after hysterectomy, the sex life is better. You know why? Because remember, hysterectomy is done for a reason. People may have abnormal bleeding, it could be endometriosis, fibroid tumors, there are pelvic pain, there are so many causes which lead to the treatment needing hysterectomy. So when this is removed, the cause of pain or the pain is gone, the woman is going to enjoy sex more. So hysterectomy is not going to affect just the hysterectomy I'm talking about, that is removal of uterus and cervix, is not going to affect your sex life at all. All it is removal of the small organ. The length of the vagina is the same. The caliber or the width of the vagina is the same. So there should be no pain or discomfort. Orgasm should be the same as well. Remember, majority of the women, they have orgasm because of clitoral stimulation and some because of the vaginal stimulation. So again, uterus and cervix does not play any role into orgasm or enjoying your sex life. Now there are some instances like a precancer or cancer lesions of the uterus or the ovaries or the tubes, or a large ovarian masses, ovarian tumors or cancers may lead to removal of the ovaries. In that case, because the ovaries are removed, the level of the hormones, which is the estrogen and progesterone and a little bit of a testosterone, those levels decrease. Now, because of the decreased estrogen, you may feel hot flashes, night sweats, vaginal dryness, discomfort during sex, also decreased libido and decreased orgasm. Only in those cases when hysterectomy is done along with removal of ovaries or oophorectomy, in those women they may notice change in their libido, or they may not enjoy sex as much as they were before. But again, there are treatments available. There are treatments in the form of hormones or hormone replacement therapy or non-hormonal medications as well, which will help take care of these symptoms. So again, even in those women, they should not worry about their sex life. All you have to do is talk to your provider, talk to your gynecologist, tell them about your concerns, and discuss the management with them. So please do not worry about your sex life. If you need a hysterectomy for a medical reason, please go ahead, have it, and discuss the rest of the management with your gynecologist.